Good evening, Rajiv ji. How are you doing?
Very fine, thank you.
Thank you. We got a little bit delayed, but anyway, it's a wonderful having you here.
Sure.
Mr. Rajiv Nath is the Managing Director of Hindustan Syringes and Medical Devices Limited, one of India's biggest, Southeast and Asia's also biggest medical device company. He's also the President of All India Syringes and Needles Manufacturers Association and the founder and forum coordinator at the Association of Indian Medical Device Industry. Mr. Nath has traveled across to many other countries, more than 60 other countries in the globe, and has attended many syringes. I know Mr. Nath personally because he's a true patriot and someone who is actually promoting Make in India in a big way. And I have seen very closely about his movement, what he's been doing. The topic that we're going to start is in the form of a question and answer. First, I would like to ask Rajiv ji, how do you see the present situation of COVID-19 pandemic? Many people and the audience are scared, the second wave is coming out actually.
Can you just repeat the question once again, the last part?
The last part is many are scared that second wave is coming out. Is it going to be much more dangerous?
Well, we hope not, because of course there has been a second wave in Europe and USA, and also we've had 3 waves in Delhi. But the country on the whole has had just one big wave so far. And right now it's on a decline, and we can only hope that there'll be no resurgence. The people who have done the right things, which has allowed the infection rate to come down, will keep on doing the right things going forward. The simple things like wearing masks, maintaining social distance, washing hands, and generally maintaining a low profile socially, minimal travels. So that would definitely help in keeping the graph further down.
Well,
so let's hope no second wave.
Yeah. Well, my next question is that many people in the audience, in fact, everybody wants to know which are the vaccines which is going to be first introduced actually. People are very much confused about it. They would like to know that which are the vaccines. I know there are 3 candidates of vaccines here. Bharat Biotech is there, then that is Cadila is there, Astra is there, then the Serum Institute of India is there. So which one do you think that is coming first? And share your experience while you injected Covaxin actually as this.
Okay. So there are 4 vaccine candidates which are the front runners, which are undergoing clinical trials currently in India. The first one and the foremost one, I think, ahead in the race is the one from Serum Institute, which is based on the Oxford formulation, and possibly should be launched in about a week's time if it's given the emergency marketing authorization. The second one in line with that is the one from Bharat Biotech called Covaxin. And the third one in line is the one from Pfizer, which requires special storage processes. And the fourth one is in line is from Cadila Zydus, which is undergoing second phase trials, and now they're seeking permission to start the third phase trials. And then very closely followed in the second batch of the vaccines after these 3 frontrunners is the one from Russia, coming from Dr. Reddy, the Sputnik one, and another one from Genova from Pune. So that's the second round. And then in the third round, we'll be having more vaccines candidates coming in from Bharat Biotech and Serum and Cadila, which will be based on innovative drug delivery systems like maybe nasal spray or oral injection, and may not need an injection from a syringe. So that's the array of the vaccines going to be available. Regarding the second part of your question, my personal experience, I had myself taken part in the clinical trial for the Covaxin vaccine from Bharat Biotech last Sunday. And it was a very pleasant experience, very good facility from ESI Medical College in Faridabad, and they were explained the whole process very nicely. got the consent form signed properly after explaining everything properly. And there were around 52 other colleagues of mine from my company, HMD, who joined me in that vaccination trials. And subsequently, nearly every day, 10 to 15 more from HMD are going on a daily basis. And on Sunday, tomorrow, I think there should be another 30 more. So more than 100 people from HMD alone will be participating in this clinical trial at Faridabad. And there has been no complaint by any one of the employees, and including myself, of anybody feeling any minor adverse event or any adverse effect like nausea or pain at the arm or the injection site, or feeling dizzy, or general incoherence, which typically can come from any vaccine, is quite normal. And there's not been a single reported any adverse event of serious nature from all over the country for this Covaxin vaccine from Bharat Biotech, even though more than 50% of the target, 26,000 people, more than 30,000 have already been vaccinated. So that's very encouraging result, and let's hope for the best.
Rajiv, my question is that a vaccine is incomplete without a syringe, and you are the biggest manufacturer and distributor of syringes. How HMD is preparing itself to meet the challenges of this COVID-19 pandemic when millions of Indians will be injected with the vaccines?
Yes, so we have been quite inspired by the voluntary actions taken by Serum Institute and Bharat Biotech. Without even getting an order from the government, they have started making the product and keeping them in the stockpile at their own end. Similarly, we also did from HMD, and until this month, we had stockpiled 8.35 crore pieces, which we are shipping out this month now. More than 6 crore pieces have been shipped out already. And to UNICEF, the COVAX facility of WHO, we have shipped out already more than 14 crore pieces in the last 5 months. This is in addition to what we are normally shipping to UNICEF for the standard vaccine programs worldwide. We are one of the top 4 suppliers to UNICEF for the standard vaccine programs for the AD syringes, auto-disable syringes, and for the vaccine, typically a 0.5 ml AD syringe is required. So just to give you an example, in June, we were having an annual capacity of 56 crore pieces per annum, which we have ramped up without any financial support by anybody. And currently, we are producing more than 70 crore pieces per annum, which will be increased to 80 crore pieces per annum from next month. And by June, we hope to touch a capacity of 100 crore pieces per annum. And by July to September, we aim to get the capacity up to 120 crore pieces per annum. So this translates simply that currently we are making around 1 lakh pieces per hour. And by September next year, we should be making something like more than 1,60,000 pieces per hour. And this is quite big because considering that for our various sizes of syringes, all of them put together, every day we make around 85 lakh pieces a day. Now, against 85 lakh pieces a day, we are currently making just for the COVID vaccine syringe 24 lakh pieces a day.
What will be the total requirement of syringes that will be required for this entire population?
Well, for India, if we are going to be targeting, say, to reach out to 2/3 of the population, so if you've got 1.35 billion people, so around 800 million people, that means 80 crore people have to be vaccinated. So 2 times, if it's going to be 2 shots, it's going to be 160 crore syringes required for that. And the government is targeting that by June this year, they want to vaccinate 30 crore people. So around 60 crore syringes are required. So by March, we'll be supplying 17.5 crore pieces. We hope to supply another 17 crore pieces by June this year. And then there are other suppliers along with us. And then there is also the inventory lying with the government from the UIP program, which has been going slow. And there may be syringes lying in stock already with them over there. So I think we are very much covered. And should the vaccine also be required to be delivered in the private sector alongside the public health care, then the availability of syringes will be even more, because in the private healthcare sector, the doctors may not use an auto-disable syringe, which is used typically in public healthcare. they may have the option of using a standard disposable syringe of 1 cc or 2 cc to give that injection, for which there are no manufacturing constraints.
Rajiv, for the benefit of our audience, could you please tell me, is the vaccine to be given to the general public? I mean, those people who are negative, or it should be given to only to the positive cases actually? If it is to be given to the negative cases, then the requirements will be very high. And how India is prepared for that?
Well, the vaccine is required for both people who are negative and people who have been exposed to the infection in the past. Even for the clinical trial, anybody and everybody is welcome for the clinical trial as long as you've had the infection at least about a month back or earlier than that. So when they do the clinical trial, before giving the injection, they do a physical, and alongside the physical, they also do a blood sampling of the RT-PCR test and a blood test also, and that is used to verify if you are positive or not. So in case you are positive, then you will not be continued in the clinical trial because that means the infection is currently on. But if you had the infection in the past, say about a month back, the clinical trials will go on. So after 28 days, you have to come back again for the second shot. And 14 days after getting your second shot, you will get the immunity to fight the disease. The interesting thing is that this is being done as a double-blind study. So what does a double-blind study mean? It means that me as a recipient and the doctor who's giving the injection, both are unaware whether I'm getting a vaccine or I'm getting a placebo. What is a placebo? Placebo is an inert liquid, something like water you can say, that is going to be injected in the body, which acts like a controlled study. So you are going to compare the results of actual vaccine candidates with those who have received the placebo to see the effectiveness.
Rajiv, my next question is that will HMD will be supplying to overseas also? Because you are the biggest one in India and many people in the world are looking at you. You've been consistently supplying them. What is the requirement from the globe actually?
So internationally, globally, if the population of the world is about 8.5 billion people and 60% need to be injected, that means 5 billion injections are required for that, and 2 times that means 10 billion are required. Now, for the Western world, which is USA and Europe, they have a specification of using disposable syringes with a needle stick prevention or a safety needle attached to the syringe. So that's a specialized design which is required by legislation and by law in these countries, the USA, the North and South, North Americas, and in Europe. Then you have the developing world, which is Africa, parts of Central America, parts of South America, South Asia, and parts of Southeast Asia, where auto-disable syringes are used because there has been a long history of syringes being reused by the people over there, and you can't have infections being spread and causing more harm because in a mass campaign, if the same syringe is given to multiple adults with such an infectious disease, it can cause more havoc. And then the third category is the category of the, I would say, developed nations like Japan or Central Europe or Middle East, where they may not need an auto-disable syringe, but they don't want to spend too much money in buying a safety needle syringe. So that's the third category. So all in all, they would be requiring something like 2 billion syringes for auto-disable, the special type like I mentioned to you, and something like 3 billion plus for the disposable syringes. So for the COVAX facility, we have decided that HMD will be offering 50% of its capacity and 50% to Government of India. That's for the whole year. But of course, seeing that between now and June, there will be a bigger requirement by Government of India than by COVAX. We intend to supply around 65 to 70% of our capacity to Government of India in the first phase. And then maybe in the second phase, we'll supply around 30 to 40%. So at the end of the year, it might even out about 50-50 between both Government of India and the COVAX facility, because we also have to honor our global commitments.
Fantastic. That's a very noble gesture which HMD is doing it, and Rajiv is known for that. Rajiv is very known for these philanthropic activities. Everybody in India knows about him. It doesn't need any introduction. But my final question, which is a $1 million question, which everybody would like to know, even I'm getting the text messages there also on the poll, when the world will be free out of COVID-19? When will we live in a COVID-free India?
Well, I've been talking to experts, my friends in the field from WHO, from immunology and the immunology departments, and their take is, I'm getting is that if the chain of infection can be broken, if in the country more than 30% of the people can be having the vaccination done, that will help to bring down the rate of the infection very rapidly. So you already have now from 97,000 infections per day. In September, we've come down to 25,000 and lower infections per day now. From more than 1,200 to 1,400 deaths per day, India has come down to lower than 300 deaths per day. So that is already going in the right direction. Vaccination drive, which Mr. Modi is trying to achieve by June this year, is a phenomenally ambitious target. I personally thought that they would be needing something like September or December to achieve that. So when the Ministry of Health started reaching out to us and started telling us that what you're offering is not enough, we need more, or you divert what you have planned for the international community and you give us first and give them later on, I was quite surprised by their ambitious targets to finish everything by June. So let's see and let's hope for the best. But it will take us the whole of this year, I think, to learn to live with the disease. But as March and June go by, I think all of us will be feeling more light-headed and more optimistic. The key thing is people need to come forward for vaccination. There is some unnecessary fear that people have for vaccination. If people have taken vaccines for diphtheria, for measles, for malaria, for hepatitis B and C, and for pneumonia, there is no reason why they cannot take a vaccine for COVID. And the people who are bringing the vaccine to you are responsible factories. They will not take any shortcuts. They have a long history and experience in this, and everything that is going to be cleared by regulators will be on a scientific background. The main thing is people need to come forward and get themselves vaccinated as soon as it is launched in January.
So here is a positive note coming from one of the finest healthcare leaders of the country, Mr. Rajiv Nath, Managing Director of Hindustan Medical and Syringes. He is giving us a message, a clear-cut message that we need to be, taking the vaccination programs, and we need to wear the mask, stay safe, stay healthy, and by come June and July, I think the situation might change and it will bring to a normal world. But we'll have to live with the reality that this is not going to go away. Because needs to be done. Thank you very much, Rajiv, for being on the show. And it is always a pleasure to be on the show because we've been always talking about all these important aspects of these medical innovations. And it has indeed given a great insight to the audience of what we just spoke about. It's indeed an enlightening one. And I'm very privileged to have you on the show. Thank you very much for joining the podcast.
Thank you so much. It's a pleasure for us to be a part of this campaign and to help the people of the country and also of the globe. We export to more than 120 countries worldwide, and it's an honor for us to be participating in all this action, even including shipments to Japan.
Thank you very much. Let us give a huge round of applause to him.
Thank you.